The coronavirus has now infected more than 7,700 people worldwide, more cases than the SARS epidemic. You might remember that happening in the early 2000s. Well, the death toll has climbed to 170 people. All of those deaths have been in China so far, where the outbreak began. Right now, we can tell you there are 5 confirmed cases of the virus in the United States. And here in Colorado, 3 people have been tested. All of them have come back negative. This morning, Colorado Congresswoman DeGette is meeting with top federal health officials about the risk the virus poses here in the U.S. We have Jacqueline Quynh, who is joining us live in the studio. And Jacqueline, I know we spoke with DeGette about this meeting. I also know that she called the meeting ahead of the first case being confirmed in Washington.
Yeah, that's right. And what we really need to know right now is that there are no cases right now that have been confirmed in Colorado and no deaths at this point. But let's take a look at the map here and see the way that it's spreading. So we know that it's sort of coming over from China over here. And then you can see sort of the hot spots on this map here. And then if we can zoom over to sort of the West Coast, you're going to see it sort of moving over there to the West Coast here in California. You'll see it in Washington and in Arizona. And then there are also some cases in Illinois. So we're gradually seeing this spread here. And that's why Congressman DeGette is working to explore what to do here. Now, DeGette chairs the House Oversight and Investigations Committee, which has jurisdiction over public health and quarantine. And she talked with our Sean Boyd recently about what they're going to be examining. Briefly, she says it really hasn't been tracked, so they don't know what to expect, but that's changing. In the meantime, the worry is that there are no vaccines, and because it's a virus, antibiotics will not work, and making detection a little bit more complicated. Symptoms are very similar to the flu, with fever, chills, and aches, and runny nose and coughing. DeGette told us she's familiar with the spread of other viruses before.
I've followed the avian flu. We had a hearing earlier, I think in November, on the flu season and what it was going to look like. So we're very concerned about the potential for this becoming widespread in the United States.
I just mentioned there's no vaccine, but there's some promising news here. The National Institute of Allergy and Infectious Diseases, an agency within the Department of Health and Human Services, expects to begin an early-stage clinical trial within 3 months. Of course, it could take about a year for this vaccine to become public, and we're going to tell you who the experts are that the Congresswoman will be working with and update you with the latest information in the next half hour. For now, back to you guys.
Wow, a whole nother part to this that's interesting coming up. Thank you, Jacqueline, for that.